is it about this time of year that brings on all of the feelings? We're talking about anxiety, depression, you name it. And what can we do to help kids who may be affected by all this?
Oh, this is a great question. Great to see both of you. Happy post-Thanksgiving. So just like adults, children and teens are also affected by the change in seasons, right? So when it's colder, when we're getting less daylight, we all feel this. And there's this funny thing that also happens as we move through all of these big fall and winter holidays, where kids who are feeling low to begin with, they're supposed to be enjoying this time of great fun and cheer, but it can actually make them feel worse. Another thing that we're often seeing is that by this point in the year, the sort of sheen, the excitement of the new school year has usually worn off. And so kids who are experiencing a lot of academic or social stress, they really start to get overwhelmed by it around this time of year.
So, Dr. Lee, if there is a child or a teen that is having a mental health crisis, when should a parent get help right away? You know, when should you jump in and say, I'm going to do it now? What are some of the warning signs that parents should look for?
Yeah, it's a great question, Ed. So the most important alarm bells are when kids start saying things like they wish they were dead or they want to hurt themselves, especially if parents are also seeing changes in things like mood, activities, concentration, sleep, or appetite. Because this can start to indicate that kids are feeling overwhelmed by how they're feeling and that the distress is getting to a level where they need some intervention. And I always say to parents, you know, if you're ever worried that your child is thinking about hurting themselves or wants to hurt themselves, ask them directly. The research shows that this is not a way of planning it in a child's mind, and it does not increase the chances that they're actually going to do something. In fact, it does the opposite, because it tells your kids, we can have the tough conversations, we can figure it out together, we will figure out together what are we going to do to get you some help so you don't feel this way anymore.
Okay, so say you are noticing some of the signs. Finding professional help, though, can be overwhelming if you've never done it, especially. So what should a parent be looking for in finding someone? And we know, especially since the pandemic, availability has been really tough. Has it gotten any easier?
Well, I wish I had a better answer for you, and I really appreciate you raising this because I think it's a concern that's on a lot of parents' minds. We have seen a really significant increase in youth mental health problems since the start of the pandemic. And unfortunately, there just aren't enough of us child mental health therapists to meet the need and the growing need for children and teens who are experiencing mental health problems. When parents are looking for someone, what I say to them is you're looking for someone who does specialize in working with children and teens. You're also looking for someone who can give you a clear explanation for how they diagnose a mental health problem and how they would recommend you treat it. And then also someone who has specific experience treating the type of concern that your child or teen has. Because there are actually different types of therapies that are better suited for different types of problems. A good place to start, I know there aren't enough of us, but a good place to always start is your child's pediatrician. Some practices have their own embedded mental health clinicians, or they will know who the best people are to refer you to.
So Dr. Lynn, let me expand that a little bit. What are some of the things that we can do to help our children's mental health, even if we can't get to a professional or not going to reach the level of a professional? What are some of the things that parents can do?
Great question. So everyone alive, every human being has times where they feel low or worried or frustrated or angry or bored. So speaking with kids, that's part of the human experience. What are we going to do to proactively help you manage tough feelings so that you don't get stuck feeling that way? So whether that is talking it out with someone that you know cares about you, doing an activity that you love, getting up and moving your body and being more physically active, spending time with a friend, the really key thing that we're trying to reinforce to kids is that you don't just have to sit here and wait for those feelings to pass. You can actively do something to try to make yourself feel better.
All right, Dr. Lee, we thank you as always for your insight. Thank you so much.
Take care, Dr. Lee. Great to see you.
Good to see you.